Clinicbe's video, and we're going to be talking about the PRP Endurette serum and the home use for it. In this video I'm going to talk about what you can expect on your appointment, talk about the transportation process of the serum as well, and how to use the product. I will also be talking about contraindications to the treatment, as well as talking about patients with skin conditions that will benefit from the treatment. On the day of your appointment, during the consultation process, we will have a chat with you to find out what your concerns are, what it is that you're willing to achieve from the treatment, and what we can obtain. We will also touch on any questions, queries that you may have regarding the treatment, have a run through the process, and establish whether you are a suitable client for the Endurette serum. After the consultation is complete, we will begin the process by taking your blood. After that, we would usually ask you to come back later that day or come back the following day to collect the serum, as it does take 2 hours to prepare, just so you're not waiting around. So on the day of your collection, you will receive a package for your serum, and I'll just run through with you what is in the package. So upon collection, you will receive a package similar to this, so you can take this away with you. I'll just run through what is in the package. You will receive a tin containing your Endurette serums. There should be around 10 vials, each containing just over 2 ml of the serum, so it will look like this inside. You will also receive 2 ice blocks, a core bag like this, and a derma stamp. It is extremely crucial for you to place the product immediately into the fridge once you get home. The product will not last unless you do so, and please remember not to put it in the freezer because this product is not suitable for freezing. So now let's talk about how to use the serum. So in order to use the serum effectively, we would require you to cleanse your skin thoroughly, so that would include a double cleanse, and if you do have a toner in your skincare regime, then to apply the toner at this point as well. After this, we would ask you to take just a few drops of the serum and apply it to your fingertips, and then spread it onto the area that you're treating, whether that's the full face or specific areas which will be discussed in your consultation. You only need a few drops, as the product is very potent, so the serum spreads very well. And once the serum has sunk in well into your skin, we usually say wait a minute or so. You can apply a soft moisturizer, very gentle, natural ingredients. If you have a moisturizer that does have active ingredients, it is worth to mention during the consultation process so you can be advised accordingly, as we don't want to undo any of the benefits from the serum. But again, if you are unsure about anything, then you can give us a call or send us an email to double check anything, and we'll be happy to guide you there. We usually advise to use the serum approximately 5 to 7 times per week. In the evening works better, but again, this is something that can be discussed in greater detail during the consultation period. And typically, the product should last you around 2 to 3 months, depending on the area that you're applying the Endurette serum to. Okay, so this part of the clip we're going to discuss about how to use the serum with the derma stamp at home, providing it's more like a skin treatment. So again, double cleanse so you can have a thoroughly clean skin, and then add toner at this point to your skincare regime if you already have one. Next, just the same as before, apply a few drops of the Endurette serum to your fingertips, and then spread that evenly across the area, so whether that's the full face or if it's targeted areas. Again, this would have been discussed during the consultation period. Next, you take your derma stamp, and then you make sure that the derma stamp, the tip is perpendicular to your skin, and then you just press into the skin, making sure that you cover all of the area. If around the eyes is an area that you are concerned about, or that's the area you were treating and had discussed with Dr. Kubicka, then I would advise to stretch the skin under your eye and then press the dermastamp around, and be careful not to treat beyond the bone. So make the bone the limit. So stretching will enable more coverage of the area. In terms of the frequency of the dermastamp, we would advise to use about twice a week out of the 5 to 7 days that we recommend the use of the serum. Again, all of these will be outlined in your consultation, and you can give us a call, or if you wanted to double check any of the information, anything you're unsure about of the process, and we will be happy to guide you through. Another benefit of the serum is actually to promote some hair growth, to stimulate the hair. So you can incorporate this with your hair treatments as well. So when it comes to using this, for the preparation, we would recommend to have freshly washed hair and dried hair. Again, so we would ask you to apply some of the serum into your fingertips, massage into the area, into the scalp, and then repeat with the dermastep. So just make sure that the tip is perpendicular to your scalp, and then press till you're having a systematic method. Make sure you're covering all the area, and then once you are done, you can rub in another layer of the serum. So typically you can expect to use a complete vial per session, and we usually recommend to use this method once a week. So now I'm just going to discuss about how long the serum will last. Typically it's said to last about 3 months, but it could vary between 2 to 3 months depending on the area of treatment and the frequency required of the treatment as well, which are all going to be highlighted during your consultation process. So this really is a great time to establish a baseline for the program of the Enduret serum. It's good to use this so you can follow a regime with this as well, so it just is easier for you to follow. So the next point I'm going to touch on is how to look after your dermastamp in between treatments and how to sterilize it. So when first using your dermastamp, so when you remove the dermastamp out of the box, it will be sealed in a blue sterile packaging. So the first time you can just use it directly, making sure that you take off the white cap off the top. After that use, it is best to sterilize it straight away. It's just more hygienic and it's just easier to clean. You can do this by pouring over boiling hot water over the tip. So you can do this for a couple of minutes so the boiling water can run through and just clean this for you. And then you can repeat this once again for your next session with the dermastamp. Another tip actually that I've learnt when using the dermastamp, if this is your second session or after your second session, is probably best, it's more time efficient if you were to sterilize your dermastamp beforehand, before cleansing. So then when you lie the dermastamp onto the paper towel to dry naturally, it will, while you're doing a cleansing routine, that will be ready for you, so then you can just crack on straight with the serum and the dermastamp as well, and then again just cleansing and sterilizing after you are finished. So now I'm going to discuss about suitable candidates for the Enduret serum. Generally it's very good for skin rejuvenation, just to help for healthier skin. It's also good for people suffering with pigmentation because it's a very gentle approach to help treat that as well, and it works very well with the dermastamp, which enhances the benefits. It also works very well for scarring, acne scarring. It works really good for hair stimulation, so like on the scalp. So we can use that or incorporate that if you have any hair treatments for any hair thinning, hair loss. It's also very good for patients suffering with rosacea and acne prone skins. the serum itself is quite beneficial for skins suffering with such conditions. Contraindications to the Endurette serum. Again, contraindications is something that will be discussed in detail during your consultation. Most of the contraindications are from the stamp itself. So patients suffering with active acne or active rosacea would be contraindicated to the use of the derma stamp, as this is a risk of making this worse. However, saying so, the actual Endurette serum itself would be very beneficial to use alone, as it contains, because it's your own plasma, so it's very good for healing, so that would help. When it comes to the actual serum, there are things that can factor into contraindications for this too. So it's usually certain medications or some systemic diseases that someone may be suffering from. For example, cancer could be one. Unfortunately, wouldn't be a suitable client for that, as it involves taking blood. So it's not something that would be recommended. But again, this is something that can be discussed upon consultation, as there could possibly be ways around it, but again, it's best to find all your information there. Thank you for watching. I hope this video was very useful. If you do have any more questions, any concerns, any queries, then do just drop us a call, or you can even send us an email, and we will add in our contact information below. Thank you.
Would you like to rest your chin in the cup and your forehead on the rest at the top? Okay, is that comfortable?
That's fine, thank you.
Perfect. So now can you close your eyes? And I'm going to press the button, after which it will flash 3 times.
Okay.
To go now. Perfect, that's now done. So you can stay in the same position, and I'm going to move the machine around to the side so that I can photograph the left. Okay, and I'm going to do that now. Okay, the left side is done. And once again, if you can remain in the same position. Okay, and I'm going to take the photo now. Fantastic. Okay, so you can now relax it will take a while to initialize your photos ready for analysis. Okay, so next we're going to take a look at the UV spots. Okay, now, so this screen will reveal any areas of sun damage. So usually most people will have quite a bit, just because it is your lifetime's worth of sun exposure. So the sun damage will show up as freckles. So any of the blotches we're seeing now, which leads me to the next screen, which are brown spots. So this screen will reveal any areas of pigmentation. So this is good for picking up on more deeper pigmentation, such as hormonal, melasma, as well as sunspots or any lesion on the skin. So you can see a bit more clearer as well, whether it's just general uneven tone on the skin. And this is really useful for treatment because it just allows us to see where there's more of an issue. It's fantastic when selecting what treatment is more suitable. Now the next screen, this will show us any areas of redness, which usually is a sign of sensitivity. So people that suffer particularly with rosacea, thread veins, this is very useful because it will show us if there are any areas that may not be apparent on the surface of the skin, but it will show us if it's likely to be an issue later on down the line. So you can already see from this image here that there is more of an accumulation of capillaries on the nose, or certain areas like the side of the cheek here. It's an indication of inflammation. Now this final screen will show us porphyrins, which is also referred to as P bacteria, which are areas of bacterial excretions most commonly found in somebody with an oily or combination skin. So you can already see some fluorescent orange spots here. This is an indication of excess oil, very common on the T-zone area, as you can see here. However, on yourself, we're not picking up on any porphyrins, although you have quite clear skin. So usually somebody that does tend to suffer from breakouts would usually have porphyrins or bacteria on the skin. Okay, so there is also a feature for analysing specific areas, which is handy if you want to take a closer look at the texture of the skin. So I'm just going to select the side of the face. Okay, and I'm just going to mark out an area for analysis. So we can see this area here, there are some lesions and a bit of inflammation, so I want to take a closer look there. Okay, so at the end of the analysis, we can have an overview. Now this will just show us all of the images, so the standard image, but also all of the screens that we've just had a look through. So this is really good for comparing and contrasting and helping us to select the most appropriate treatment for you, and also skincare. So looking at this, the sun damage is a bit more pronounced to me, so I think you would be a very good candidate for the IPL treatment, which designs to pick up on pigmentation and will also treat areas of dilated capillaries and broken capillaries. Okay, so now that we've selected our area for closer analysis, I'm going to click the Analyze button and we will see what we have. So the first screen here has picked up on spots. So this can be any type of lesion, whether it is a pustule or a papule. It's also picked up on a small freckle as well. Okay, now let's have a closer look at texture. Okay, so this is revealing any areas of pores or uneven skin surface. Okay, so this is very good if we're considering any resurfacing treatments. It just shows us where we need to concentrate that work, such as microdermabrasion or chemical peels. Okay, let's have a look to see if there are any wrinkles in this area. Okay, so the camera has picked up on some small, I'll say fine lines, not wrinkles, and these have shown up in green. Okay, and finally we shall take a look at the actual pores. So these are revealed in dark blue, And this again is more common in oily areas around the T-zone, but this just takes a closer look at any enlarged pores that may be in the area. So this is very good again for considering resurfacing treatments such as chemical peel, microdermabrasion, or for somebody that may have an issue with pitted scarring as well.
Mm-hmm.
So at the end of the texture analysis, you can once again perform an overview of the entire session. So this will again show your standard photos, but also along each spectrum. So you can have a look at the sun damage, pigmentation, redness, P bacteria, as well as the texture concerns. So this is really good for the end of your consultation to consolidate the findings and to really then come up with the best course of treatments and skincare products. Okay, there are some extra features on the VISIA skin analysis machine, such as the true skin age, which tends to be a popular one among many. So I'm going to click onto that now. So in this feature, we'll calculate using your actual age, which we enter at the beginning of the analysis, taking into consideration your results. It will then form your true skin age according to what we have found, which in this case is 48.
That's okay.
And this feature is useful so that, say, 6 months or so down the line, once you complete a treatment course and finish your skincare regime, we can then perform a second analysis, and we can compare the results from your first and second analysis, and we can see if there has been any change or improvement in the skin age and your overall skin condition. Okay, so after looking at the texture of the skin, we have just done a 5-minute microdermabrasion session on this particular area, and we have done a second photograph after that session, and we can already see a difference, an improvement to the skin. So if you look at this area here where we picked up on spots previously, you can see from the side-by-side comparison that there are less areas outlined, which is an indication of less spots being picked up. Also, looking at the wrinkles, you can see in this first screen we picked up on more wrinkles in this area, whereas after a 5-minute microdermabrasion session you can see that there are less. Now looking at the overall texture of the skin, again you can see that it's picked up a lot more blue and yellow areas here, which is an indication of more rough and uneven texture. After a 5-minute microdermabrasion session, you can see that is less dense in this area. And then when it comes to pores, again, you can see it's a lot more populated with enlarged pores. Whereas after the microdermabrasion session, again, there are less pores being picked up. So you can see already after a 5-minute treatment, an improvement can be observed on the surface of the skin. So just imagine when you complete a course of treatments, when you complete a course of skincare products, you can imagine the results that you would see. And it also shows how accurate the machine is as well at picking up the changes on the skin and concerns on the skin.